Child mortality remains one of the world's greatest challenges. Too many lives are lost to preventable diseases. Too many families are left with unanswered questions. And too many health programs lack the information needed for best results. But what if we could change that? In 2015, Child Health and Mortality Prevention Surveillance, CHAMPS, launched with a bold vision to create a world where evidence-based interventions offer every child an equal chance to thrive. With funding from the Gates Foundation, CHAMPS scientists introduced an innovative approach to investigating causes of stillbirths and child deaths in high-mortality areas in Africa and South Asia. The high-quality information generated would enable policymakers and healthcare leaders to enact changes and make this vision come alive. At the heart of CHAMPS is rigorous science. When a child dies, and with the family's consent, CHAMPS teams collect small amounts of tissues through a process called minimally invasive tissue sampling, or MITS. These samples undergo a series of advanced diagnostic tests. CHAMPS teams listen to each family's story and review medical records. All the data are reviewed by a panel of local experts to determine causes of death. CHAMPS doesn't just document deaths. CHAMPS investigates what happened to each child. Through better understanding, deaths can be prevented. Building trust in the community is the foundation of CHAMPS. CHAMPS teams work with community leaders to understand how best to engage in a culturally appropriate and sensitive way with families who have suffered a stillbirth or the loss of a young child. Our teams ensure our findings provide the answers that families, community leaders, and healthcare providers have been waiting for. This information is used to improve health. Since its founding, CHAMPS has grown from a pioneering idea to a global surveillance network. Now in its 10th year of operation, CHAMPS has examined over 8,500 deaths in 9 countries in South Asia and Africa. CHAMPS has uncovered a higher than expected burden of deaths from HIV and from bacteria that are resistant to most antibiotics. The data show that serious infections like pneumonia, sepsis, meningitis, and diarrhea continue to harm far too many children, especially those who suffer from malnutrition. And CHAMPS findings highlight the ongoing and urgent need for better prenatal and delivery care, which would allow many more families to have healthy babies and healthy mothers. Importantly, CHAMPS' careful investigations show that 4 of every 5 deaths are preventable with medicines and interventions that are now available. CHAMPS provides timely, accurate data to those who can act. Our findings bring families closure, highlight key health practices for communities, and show healthcare providers how to improve their practices. On a larger scale, the findings can strengthen health systems, guide policy and resource allocation, and lead to new products like vaccines. We've shown that when science, policy, and action align, lives can be saved. As we mark a decade of learning and impact, we look ahead to a future guided by innovation. CHAMPS will continue to expand its reach through partnerships and data sharing, so country leaders and global partners can act together to reach sustainable development goals. CHAMPS teams around the globe will continue to pursue excellence in our work because every child deserves a chance to thrive. From unanswered questions to informed actions, CHAMPS is supporting the child survival agenda. We are just getting started. Join us in writing the next chapter of maternal and child health. Together, we are CHAMPS. Together, we can save lives.